Good morning, everyone. Today we are at National Jewish Health, and joining me today is Dr. Andrew Freeman, and we are talking about the Walk with a Doc program. And so I'm going to, real quick, I'm going to share this on the 9 News Facebook page, so if you'll just bear with me for a minute. And hey, check out this beautiful garden. This is where we are at today. This garden is absolutely amazing. Do the patients get to eat the food from this garden?
This is actually mostly one of the school projects here at National Jewish in an effort to improve health of the students.
Oh, that's so great. That's cool. So the student doctors, is that?
No, there's actually a school on campus here for those with chronic illness such as asthma. And this is just one of the efforts that one of our restaurant partners and friends of the school have. I don't claim to be responsible for most of this, but a variety of vegetables, as you can see.
Oh, that's really awesome.
Yeah.
Oh man, I'm jealous. I would love to have my own garden like this someday. That's really nice. Okay, I'm just about done sharing this on the 9 News Facebook page. That way more people can get this really good information. Alright. Okay, so Dr. Freeman, tell me about this Walk with a Doc program. How does this program work?
Sure. So we've actually been doing Walk with a Doc now for a little over 8 years. It actually started with a cardiologist in Ohio, who's a good friend of mine. And when I came out here in practice, I started it here. But the goal is really to use exercise as medicine. And believe it or not, even Hippocrates, the founder of medicine, knew the power of exercise. But most of us doctors don't do a lot of lifestyle, diet, exercise, all that good stuff. So one of the things we started to do is we would say to our patients, you should exercise, but nobody ever wanted to do it. But now we have a program where, similar to when you try to save money, your employer takes some money out and puts it away for you. Now there's an automatic way for you to exercise with your doctors. So the program is really unique because we put on shorts and sneakers like everyone else, and we walk side by side with our patients, but we start every program with an educational component. So we basically spend time teaching the patients about some high-yield health topic, coronary disease, heart attack, stroke, COPD, emphysema, whatever it may be. And then from there, after we do that for a few minutes, we go for a good brisk walk. And of course, there's healthy refreshments, fruits, and that kind of thing for people to eat.
Okay, that's nice. So when you go for this walk, you've had your topic that you talk about. Is that a time for people to ask maybe questions related to that topic, or are you just walking? Or tell me a little bit more about that.
It's a way to be informal, right? So I'm not giving specific medical advice on these walks, but people ask a lot of general questions. A lot of people ask nutrition questions, fitness questions, but we're walking and talking with our patients. We're sort of walking the walk, so to speak, to show people the power of exercise as a way to not only prevent disease, but also to help cure a lot of disease as well.
That's really cool. So what kind of things do people ask you while you're walking? Like what kind of topics come up? And what kind of topics do you cover? Well, you kind of mentioned that before, but I know some people might be joining us right now. So
sure.
Tell us again about the topics that you might cover, and then kind of the questions that people ask as they're walking.
So first, there's a full topic list at njhealth.org/WWAD Walk with a Doc. And you can see it all, but we do everything from osteoporosis, rheumatoid arthritis. Our upcoming one that's coming up is on women and heart disease. We just did one on holistic health. So we really talk about a wide range of topics, many of which come from the participants. We usually get anywhere between 50 and 150 patients at every walk.
Wow.
And sometimes we do special walks. So for instance, our last one that we did was in partnership with a restaurant where they showed us how to make plant-based foods that were really tasty and nutritious.
That's awesome.
And then we usually have really great refreshments and all sorts of giveaways. So we really encourage people to come back over and over again in an effort to really try to improve their health.
What kind of stuff do you give away?
It depends. So we've given away everything from ice scrapers in the winter to beanies to cell phone holders, and every new participant gets a t-shirt and a pedometer. And then there's always coffee, usually from Starbucks, and all kinds of fresh fruit and all kinds of healthy snacks.
So if you've gone once, can you still come again?
Always, yeah. In fact, most of the people who come keep coming. So our program has really grown. In the Denver area, in addition to the one that I help to host every month, we have one almost every week, and we even have them in Boulder as well.
Okay, so Denver and Boulder.
And then actually in other places, Grand Junction, Greeley, Pueblo, they all have their own Walk with the Docs that I help to bring to Colorado.
That's really awesome. So how did that work, you bringing this program here? Like, did you just call up some doctor friends and be like, hey, would you be interested in starting this program? How did it?
It really was just a one-man show, and then I was able to get a number of my colleagues that I work with directly to help volunteer with me, and a number of great support staff. So we check blood pressures, we now do spirometry, which are lung function tests, and we slowly built and added to the program. So when we first did it, there's probably 10 or 15 people. and nothing really much to give away, and maybe some water to drink, and now we have coffee and fruit and giveaways and t-shirts and all kinds of stuff. So we've really added to the program to make it really high value, and so that people want to come back repeatedly.
That's awesome. So does it cost money to come to this?
No, it's absolutely free. It's supported by National Jewish and a number of other great sponsors that we have. People who really value the lifestyle approach to medicine, where it's more lifestyle, better living, healthy living, and less medicine in the long term.
Okay, so when is the next one?
So our next one is actually July 14th, which is a Saturday, but you can actually find the other ones that are hosted by my colleague doctors around the city, again at njhealth.org/walkwithadoc or WWAD.
Awesome. Okay, well that's really exciting. What is like the biggest thing that you want people to take away from this for why they should participate?
So I think most people underestimate the power of walking, right? So for a lot of people, taking a pill is a lot easier, but we all know that pills have side effects. We all know that pills don't actually cure the disease in most cases, they control the disease. So what we're looking for here is a chance at a cure or a significant improvement with less medicine and less doctoring, believe it or not. So exercise really should be the best medicine for the vast majority of diseases, and over 75% of the healthcare expenditures in this country are on lifestyle-related disease. So we can really do wonders to not only help our budget and our country, but our own individual health and productivity just by changing the way we live every day.
Yeah. No, I think that's great. I think I'd much rather go for a walk than take a pill.
Right. And I always tell people, you want to get 10,000 steps used to be in, but now it's 20,000 steps every day.
Really?
If you can do it.
20,000, not 10.
Not
Because I feel like, I have to admit, I feel like I barely get my 10,000. I feel like every day I go to bed and I'm at like 9,000.
Yeah, so the goal is to get as much as you can get in.
Okay,
Remember,
20,000.
before cars, we would easily get, 10 miles a day walked. So now we got to try to do that again. And remember, 10,000 steps is roughly 5 miles, so we're looking for that 10 mile if we can do it.
Okay, well this is one way to get those steps in, come be a part of this program, and it's great because you're going to get your exercise and you're going to learn something too.
Right. So we try to create empowered and knowledgeable patients, which I think are far better patients because when they go in for a condition, they know more about it, so they can make better decisions.
Yeah.
And then I think if we can prevent disease, that's really where the money is.
Yeah, well, and I definitely think it's a lot more affordable to prevent disease than to have to...
Without a doubt.
Yeah, so, okay, well, this is great. This program's free, so again, it's Walk with a Doc, and tell us again the website one last time.
So it's NJHealth, nationaljewishhealth.org/WWAD, Walk with a Doc.
All right, and so after this, we'll put that in the feed, in the comment section, and then if you guys have any questions or comments, just leave them in the feed. We'll get back to you later. And yeah, if you know somebody who could benefit from this program, definitely share it. Share it with your friends. Tag a friend, see if they want to go with you. I think it's a really good program.
Well, it's hard to beat free food and free giveaways and free advice and free everything. And,
do we have a question? Oh, sorry.
I actually don't have a question, but I have a great comment. It says 10,000 steps, 5 miles, time to go to the mall. Thanks, Sharon.
I like that. Yes, go to the mall. That's one way.
Definitely one way. But I would say there's lots of easy ways to get walking into your daily life. Park far in the parking lot, take the stairs when you can, walk the dog an extra time in the day, whatever it takes, and then try to get in a dedicated 30 minutes of breathlessness, which is really the goal every day.
Okay, so that means like walking so fast you can't talk.
That you can't have a full conversation, right?
Okay.
So if you're having, a good old time with your buddies, you might want to pick up the pace just a smidge, at least initially,
Okay.
and then back off if you want to.
Okay, well I know I learned something new today. It's now 20,000 steps, not 10,000, so I really got to kick it into high gear. So maybe I should do the next Walk with the Doc.
Yes, come join us. It'd be great.
All right, great. Well, yeah, thank you. Thank you so much for giving your time today and
pleasure.
doing this with us and helping us to let everyone know about this great program that you guys offer. And to all of you out there, again, share this, tag a friend, get them to go with you. I think it's a great way to get your steps in, a great way to get some exercise, and to learn about your health. So yeah, and we'll have a blog later today. We wrote a blog about some of the benefits of walking and some tips on how to get more walking in. Like one of the tips is to schedule it on your calendar. So say at 10 a.m. I'm going to go for a 15-minute walk.
Right, and a lot of the new watches will remind you to stand up and walk anyway, so grab one of those.
I got my Fitbit.
Yeah.
It tells me when. 250 steps every hour. It's not too bad.
No, there you go.
That's like a stroll around the office. just on the floor, just a couple laps.
You got to set it up to 500.
Man. I got work to do. All right, that's good to know, though. Good to know. All right, well, thank you again.
My pleasure.
Next week, we are talking about, trying to remember, let's see, I wrote it down. Oh, yes, we're going to talk about advanced directives next week. So that's also very important. So we'll be talking about that with Dr. Camilla Sasson from 9 News. So thanks for joining us.